In the post-operative period, abdominoplasty doesn't need to be as painful or troublesome as some people fear it to be. With modern anaesthetic and modern surgical techniques, abdominoplasty can be a day surgery procedure. So you come into hospital, have your procedure, and then you're home again that same evening. This is quite safe, it's commonly done, and generally produces very good recovery rates. Key issues: make sure that you follow the post-operative instructions. We like to see our patients the very next day to make sure everything is going fine. It's important to realise that you will get some degree of bruising, you will get some degree of post-operative pain and discomfort. The issue really is to make sure that we manage these things quite well, and they can be managed quite well and safely. One of the things that we worry about with any surgical procedure is how well the wound is going to heal, and that can be affected by infection or excessive bleeding and blood supply problems. And so the post-operative period, where we keep close contact with you in the clinic, is to safeguard against the occurrence of this type of problem. Most importantly, you'll be given an emergency phone number to call at any time of the day or night should you have a problem after your procedure. Don't hesitate to give us a call if you feel as though you require some assistance. Now, after a tummy tuck, some people need to have some drains. Now, this is not automatic, but in some cases drains will be required. We will monitor those on a daily basis in the post-operative period in the clinic, and it's most uncommon for drains to be in place for any longer than 48 hours, and so you could expect them to be removed by that stage, and you'll be able to shower freely and mobilise more easily without the drains. The other issue that is very common with abdominoplasty is a support garment, and this is provided for you with the surgery. The support garment does exactly that. It helps to give some support and reassurance to you and your abdominal wall after the surgical procedure. The garment is best worn for at least 2 weeks after the procedure, and in the first week you should wear it, if possible, day and night. You do take off the garment though to have a shower, and you replace the garment after the shower. Do not shower in the garment itself. It's fine to throw it into the washing machine and hang it up on the line. They dry surprisingly quickly, but you will find that they're of good value. It's surprising that in the early stages most people can't wait to take the garment off because it feels too firm. But interestingly, as soon as they take it off, they can't wait to put it back on again because they suddenly realise how much support it's giving you. The big advantage is to be mobile, not bedridden, because that also speeds recovery and reduces the risk of the more serious types of problems like blood clots, etc.